We're very fortunate to have, well, first I should say that the session, I think it links very nicely to some of the things that came up earlier this morning in terms of policy and community action and community engagement and community involvement, which is a very important theme for us here at our school as well. And we're very fortunate to have another terrific panel, I think. And as a moderator, we have we're very happy to have our very own Mallya, who's been the Director of Policy and Planning for the Philadelphia Department of Public Health for a number of years now, since 2008, and also has a background in medicine and was a Robert Johnson Clinical Scholar and has done some really terrific, outstanding work here in Philadelphia on a number of fronts. And so he will be introducing the speakers and will also be making some comments himself. So, Giridhar.
Okay, well, thank you so much to Anna and the Drexel University School of Public Health for hosting this symposium. I think it's a very, very much needed time for us to all come together, learn from one another, and really leave energized and thinking about ways that we can translate research into action. And I think that's much of what you're going to hear about in this panel. It's a question that constantly comes up as we all do our work every day, whether we're in academia, working in government, or working in community settings. And sometimes we're working in all three, whether we know it or not. But I'm excited about this panel and the folks that we have speaking on it today. We will have 3 presentations. I will introduce each of the presenters individually before they speak. I hope we will have some time to take 1 or 2 questions after each of the presentations, and then we will definitely have time for the panel discussion at the end. One last thing is, after the 3 speakers, I will provide a short summary of some of the practical considerations that we've faced here in Philadelphia, and I think that other practitioners and policymakers face across the country and really internationally as they're trying to implement policy. It's critically about the research and the knowledge that we bring to those decisions, but it's also about some other things, and I hope to be able to cover them. So our first speaker today is Billy Giles Cordy. Professor Billy Giles Cordy is the director of the McCaughey Vic Health Community Wellbeing Unit in the Center for Health Equity at the University of Melbourne. Professor Giles Cordy and a multidisciplinary team of researchers and postgraduate research students have been studying the impact of the built environment on health and well-being for over 2 decades. She leads an NHMRC Center for Research in Excellence in Healthy and Livable Communities, which was established in 2014. And we're really excited to hear about her experiences being a leader in research and policy action in Australia and how they're relevant for us here in Philadelphia. Billy.